Hello everyone. Stouffville PharmaSave is pleased to present this video in which we will be discussing general guidelines for medication administration. These guidelines have been developed to ensure medications are administered to patients safely, accurately, and consistently by staff working in a group or nursing home. In addition to reviewing medication administration guidelines, we will also go over the documentation process, the 5 rights of medication administration, and at the end of this training, there will be a quiz on the content discussed in this video. So let's get started with the general rules and guidelines for medication administration. First, we have to ask ourselves, why do we have rules and guidelines for medication administration? Well, we've been given the responsibility to ensure that we take good care of our clients, so we need to follow the right procedures in order to reduce the risk of errors and harm to our clients. We also need to feel confident that our coworkers follow the same steps that we do. This will reduce confusion among coworkers, it'll reduce the chances of errors, and the clients will be more comfortable with a consistent way of doing things. We're always focused on the safety of our clients, as we should be. However, we need to keep ourselves safe as well in order to continue to help our clients. So ask yourself, do I have the right protection? Do I need help to complete this task safely? Do I have the right knowledge? Do I have authorization to do what I've been asked to do? And how will others know what tasks I've completed? So these are some of the questions that we will cover throughout this presentation. Hopefully by the end of this presentation, we will know how to go about answering these questions for ourselves. So starting with what we're authorized to do. First, all medications you administer to a client need to be prescribed by a healthcare provider. This includes prescription and over-the-counter medications like vitamins, Tylenol, Gravol, and eye drops. And second, the prescriber instructions for each medication should be followed exactly. And if you need to change the instruction for whatever reason, you must ensure that you have the authorization to do so. So let's move on to preparation. So first off, ensure that you make the time to complete this task in its entirety. Do not try to multitask while administering medications. You want to make sure the environment is suitable for medication administration. You need to make sure the lighting is good, the area is uncluttered, and you must make sure that the environment is clean. You also want to make sure that you're using proper hand hygiene techniques. So, clean environment, clean hands. After removing medication from its designated storage location, you need to compare each medication to what is written on the Medication Administration Record Sheet, or the MAR sheet. Check the medication label or the blister 3 times. First, when the medication is removed from storage, then immediately prior to removing from the container or packaging, and finally, when returning to the storage area. Before removing from the labeled packaging, have a coworker double check and document. You want to make sure dosage calculations are accurate, so you always need to engage another coworker to double check your math whenever calculations are necessary. Additionally, we don't want to administer medication from an unlabeled or illegible container. We always want to be sure of what we are giving to our clients so that we can keep them safe. To continue, crush or split medication only if appropriate. If you are required to do this, ask yourself if you need protection such as gloves. Pre-pouring medications for later use is unacceptable. For instance, do not leave medication at a client's bedside to be taken later. We want to be the ones administering the right medication at the right time. And finally, know the purpose of each medication and how to administer it. if you have any questions, call PharmaSave to make sure you are doing the right thing. Clients must be identified using the MAR and the client's armband or whatever policy is in place for positive client identification. You have to use 2 client identifiers. So this can be the name, the date of birth, medical record number. It just has to be 2 identifiers. So ask yourself, why does this client need this medication? And does the route of administration make sense? For instance, if you're asked to apply a rash cream to Mr. Smith's foot, but you don't see a rash, check the other foot and make sure you've got the right client. It's so important to always make sure you are dealing with the right client, and that is why we need those 2 client identifiers, and we need to make sure we know why the client is taking it. All right, so are we done at this point? Well, we might have administered the medication, but we have to document everything on the MAR sheet. Documentation requires 2 staff members, and it's important to always document anything that is out of the ordinary. We'll cover this in more detail in the next section. And finally, we want to ensure that we're putting the medications back to their appropriate locations, whether that's a locked cabinet or in the refrigerator, and we want to put any waste in the appropriate containers, such as needles into a sharps container and fentanyl patches on the return card provided by PharmaSave. In addition to everything we've covered in this section, don't be afraid to reach out to the pharmacist at PharmaSave and ask us any questions you may have. You can ask questions about drug information, procedures, storage, anything that you don't know or need a refresher on. PharmaSave is always here to help out. Moving on to documentation using a medication administration record sheet, or MAR sheet. So this is the MAR sheet. The reason why we document everything is so that others have a way of knowing what tasks we've completed. We also need documentation that accurately demonstrates that we did our job, should anyone ask us to prove what we did. So always administer medications for 1 client at a time. Check the patient's MAR sheet to determine if the client requires a medication to be administered at this particular time. If they do, ensure you obtain each medication listed on the MAR sheet for this particular administration time. Most medications should be located in the client's blister pack. However, some medications may need to be obtained from the fridge or from the patient's bin if it's a liquid, cream, eye drop, patch, or inhaler. Check that all medications contained in the individual blister match the medications due on the MAR sheet for that time. When you do this, have another staff member do the same check. When you're sure that you've got the right client, the right medication, and the right time, take the sealed individual blister to the client, open it up, and administer all doses as directed. A coworker must witness the administration of all the medications. After you have properly administered the medications to the client, return to the MAR sheet, write your initials in the box that corresponds to the correct date and time, and do this for each medication on the MAR. A coworker must also sign the MAR sheet along with you. Document any out-of-the-ordinary events as well. A client can refuse medication, and that's something that we need to document. A client can have an adverse reaction to a medication, and we need to document those details as well. This is one reason why we document everything after administration, not before. We can't predict if a client will refuse medication or have an adverse reaction. So documenting after will help us document accurately, and it will reduce the risk of error in documentation. Now you can move on to the next patient. So that covers the general guidelines for medication administration and for MAR sheet documentation. Again, if you ever have any questions, you can contact us at Pharmasave. We are always happy to help. Thank you for watching.